by Angie, who is working with the Global WASH cluster. So I now hand over to you to Estelle for the Global Education cluster. Estelle?
Thank you very much, Pamela, and thank you, colleagues, for inviting us to present on the documentation of good practices in education cluster. So this whole work is being generously funded by the ECW, which is actually a critical donor and champion of gender equality and GBV risk mitigation in education in emergency. And I also, before I start, want to thank the 13 GBV AoR coordinators for the time and for the fruitful exchange that we had. It was really interesting to have the perspective on the work they're doing on the ground and how they collaborate with the education, but also thank to the global GBV AoR for accepting to be a part of the reference group of this work. So why was this consultancy or this documentation important? From the past year, the GBV, GC has started work on gender equality and GBV risk mitigation, and it really set GBV risk mitigation as a sector priority, including in the GEC strategy 2025, where it is clearly mentioned that identification and mitigation of GBV risk is an education cluster priority. And the GEC has also been supporting education cluster colleagues on the ground to in countries to carry out this core mandate, but also the responsibility. Through since a year, they have invested in Marina, who is the GEC specialist and gender integration, who is working actually at the global level, but also at the supporting countries in carrying out this responsibility. Next slide, please. The next one. Okay, so this work was very important, as I mentioned, because of all the engagement and the commitment done by the GEC, and it was really the objective of this work was first, as I mentioned, to document and also share good practices on what colleagues on the ground are doing as education cluster in fulfilling that core responsibility of theirs, but also to capture how the education cluster and the GBV AoR colleagues are exchanging, but also collaborating when it comes to GBV risk mitigation. And finally, to provide recommendation based on the exchange that we had with the two sectors coordinators on how to tailor, but also replicate some of the good examples in other emergency contexts. So what are the key findings of this? Next slide, please. The key findings of this documentation that we've done. First of all, out of 12 countries, we did 13 interviews of GBV AoR coordinators, but also education cluster colleagues. And out of 39 are actually collaborating, which is already good. It's above 60% of the countries, and it's really interesting. Although the collaboration, it's not something that is systematically established, it's still important to see that there are areas where they are working together. And those areas are around basically capacity development for education cluster colleagues. They're also working around strategic document review. They're also working around support. So the GBV AoR colleagues support the education cluster in information, but also data provision around the whole HPC process when it comes to data analysis or GBV risk and barrier mitigation. But they also do consultation. Basically, the education colleagues consult the GBV AoR during the process of development of their strategy. And finally, they do together review of integrated project, either joint project between partners, but also project with other sectors. The main enabling factors for that we came out from the consultation is basically the humanitarian coordination commitment. So when you have OCHA leading the work around cross-cutting issues, it helps a lot for the work between the two sectors, but you also have the institutional commitment, for example, UNICEF committing as cluster lead education for education, but also Save the Children as co-lead. But on the other side, UNFPA also committing on GBV risk mitigation. That really helps the two sectors to collaborate on the ground. There's also something that really lies on the willingness and the past experience of coordinators, both on the both side, but also finally on the grant and donor conditionality. There are a lot of more and more donors are putting GBV AoR as something that is really important for their work. So partners are more and more willing to work on GBV risk mitigation. But I have to mention that this grander conditionality for now benefits more for gender integration or gender mainstreaming than to GBV risk mitigation. And the key challenges that colleagues face on the ground is, first of all, the priority. So it's something that really is outstanding was outstanding in the discussions that we had. Sector have to prioritize the work, and usually what they prioritize is the response. It's not really engaging with other sectors. So they prioritize the response, but they also prioritize sectors that they have to work with. So basically, when the GBV AoR colleagues have to prioritize the response, they usually work either with WASH or health or CCCM or nutrition clusters, and the education cluster also, when they have to work with other sectors, it's usually either CP or WASH. So both sectors comes, after, let's say after when they have to prioritize, both sectors don't really come as first sectors where they work with. There's also something that is challenging around the context and also the phase of the emergency. In contexts like northwest Syria, for example, where the mandate is renewed every 6 months, it's really difficult to be focusing on, engaging other sectors. So what they do is, whenever the mandate is renewed, it's really time consuming. So the focus is more on the direct response to survivors than, working with on GBV risk mitigation. But also the phase of emergency, at the height of an emergency, when there is no access, when there is limited partners, the work is really focusing on sectoral responses than, engaging with other sector. And also the lack of understanding between gender integration and GBV risk mitigation is something that comes a lot on what does it mean, what do we have to do, which is also linked to the lack of understanding of roles and responsibility in GBV risk mitigation by the education cluster. But I think this is also something that apply for all the sectors apart from the GBV. It's really difficult to understand what are the responsibility of other sectors when it comes to GBV risk mitigation. Next slide, please. So during the discussions, there have been a lot of thinking around, so now that we agree that there are some things to be done, how do we move forward? Where do we go from there? So first thing that came out from the discussion is, well, there is a need to agree on the collaboration, but this is already there. So there was an acknowledgement by the two sectors that we have to work together, but it's also important to put something that is, sustainable in place. So the first step, as we're suggesting, looking forward, is to first agree on the need to collaborate, and then the next step is to also also identify the means of collaboration. It could be either the appointment of focal point, which is happening in other sectors, or establishing a monthly call or something, but there are good practices and good examples that are already happening in other sectors. But now also the third step would be to identify entry points. There are many entry points run through coordination, but also through programs and projects that were identified by the two sectors as areas where they could collaborate. But one thing that we think it's really important as an entry point is already sharing by the education cluster of the referral pathways, but also providing systematic training, for example, to teachers on how to, handle GBV disclosures. That could be something that is an entry point and then open the way for the other areas of collaboration. And then as a fourth step is to set priority for collaboration. And there are so many areas. So I think it's for each country, it is important to see what are the areas that they want to prioritize and how they could move forward with that. And then finally, establish a monitoring framework, which is really important to see how far they're going in the work they're doing, but also what are the things that they should, improve, and then lessons learned, and see how to move forward. And finally, I just want to leave you with this very interesting quote that I found during our discussion from an education, from a GBV AoR colleagues. It says, it's really, there's so many areas where the two sectors could work together. And I also want to put some questions out for our own reflections, but also for countries that I didn't have the opportunity to interview, on how they collaborate with the education cluster in their context, but also what are the areas that they prioritize, and how in general could the GBV AoR support the education cluster in scaling up, but also in institutionalizing GBV risk mitigation efforts. So I think I'm gonna stop here. I hope I remain within the 10 minutes. I also left our contact we want to continue engagement on that subject with the GBV AoR. So I left the contact for a further engagement. Thank you, and over to you, Stephanie, sorry.
Thank you so much, Esther. That was really, really interesting. I'm going to open the floor just for 5 minutes for any questions or comments from the group. I don't think in the chat, I'm going to see if anyone put something in the chat. No, not yet. Feel free to unmute or also write it in the chat. Otherwise, if there's no questions at the moment, we can also move and do the second presentation on the WASH cluster, and maybe then look at both together. Okay, I think.
Over to you, Angie. I think Angie will share her screen.
No, I'll be sharing as well. Don't worry.
All right.
We had a last minute change, Pamela, to speed up the exchange. So first, a big thanks to Pamela for reaching out to Stephanie and making this space for a presentation today on the WASH Insecurity analysis. Some of you may have heard of it before. It was previously the WASH severity classification, but it's an initiative that's being led by the Global WASH Cluster, with support also from the WASH program group within UNICEF, and then the Data Analytics and Planning and Monitoring Division. So it's a cross UNICEF initiative. And today I wanted to talk to you about a specific element of the analysis that's focused on integrating gender-based violence risk into the analysis. Next slide, please. So the WASH Insecurity analysis is like a lot of analytical tools that we see within the humanitarian sector. It can help us classify geographic areas based on access to water, sanitation, and hygiene infrastructure, as well as WASH-related drivers of insecurity. And that includes natural or human-induced hazards. It helps us quantify the number of people at risk of becoming WASH insecure and those that are already experiencing WASH insecurity. So for us, really, we see it as a tool and a process that can help inform decision-making across the humanitarian to development continuum, because we're looking both at populations that are affected today by substandard wash services or exposed to natural hazards, but also those that are at risk or have high levels of underlying vulnerability, such as those that would be relevant in development context. Next slide, please. Here, I'm not going to go into this, but you can see kind of the analytical framework that we work from. On the left, we have the exposures, our shocks and stressors, and our vulnerability, which is our overall dimensions that we use in the analysis. And then within each dimension, we have different themes. You can see here they're listed. So WASH, we have biological hazards, environmental, human-induced, and then we have health, social, and economic themes. Within each theme, then we have macro indicators. And within each set of macro indicators, then we have subsets of micro indicators. So it's kind of a detailed process, but basically we take all of our indicators and we roll them up to create a single number to help us understand what is a level of WASH insecurity in a given geographic area. So kind of as you saw in the map on the first slide, this analytical framework, these indicators form the basis of how we do the analysis to create a score. To indicate where we need to consider where that we can use for decision making, basically. Next slide, please. So what kind of decisions are we trying to make and who are the users? So the first thing to say is that this is really a sector tool. It's not a UNICEF tool or a one-off UNICEF initiative. It's really a sector tool that for now we're really trying to embed within the humanitarian contexts through the Global WASH Cluster, but also through engagement with development actors in fragile contexts as well. So we can use the WASH insecurity analysis for a range of purposes. We can use it for planning or prioritization and ranking. So this is particularly relevant for looking at making decisions on where the WASH cluster might indicate to partners where there are gaps or priority needs. We can use it for preparedness or anticipatory action because it can tell us in a given geographic area who is at risk of becoming WASH insecure. We can use it to monitor over time. We can use it to help with decision making for nexus and collective outcomes or deciding where we allocate funding. And it can provide alerts. So we don't do any forecasting, but we integrate other forecasts into the analysis. And we can also use it for advocacy to say that there are unmet WASH needs in a certain area or a high number of WASH insecure people in a certain geographic area. And that can really help the WASH sector to have a more common analysis, because right now we don't use the same methods, the same tools, the same data to make decisions. And so we're really striving to have more evidence-based data-informed decision-making. So the WASH insecurity analysis is a part of that. Next slide, please. So where does gender-based violence come into this? We have 3 levels of analysis within the WASH insecurity analysis. And on the left, you see the base score. And this is really the core of the WASH insecurity analysis. And that includes all of the types of indicators that we looked at previously in the presentation. You know, your WASH service levels, whether or not there has been a drought or a risk of a drought, whether there are high levels of poverty in a country as a part of underlying vulnerability. So all those indicators are part of the base score. But we know that those indicators don't always tell the whole story of WASH in a certain country. And so what we need to do is we need to add more data, and we need to have a more granular, more detailed picture of the needs in a specific context. And so what we have is what we call a modular approach. And these modules can integrate common but not globally available data into the base score. So this is where the gender-based violence risk indicators are really interesting, because we decided that there are so many linkages between WASH and gender-based violence risk that starting with gender-based violence as one of the first modules could be really important as a piece of advocacy, but also to raise the profile. And as Pamela was sharing before, to really support actors at the country level to be able to integrate gender-based violence risk data into this WASH-focused tool to help inform decision-making, monitoring, and advocacy as well. So the idea is that with the module, we can take indicators that are relevant for gender-based violence risk and overlay that with the data we have from our base score. So you can go to the next slide. Oh, yeah, there we go. And here's kind of an example. So on the top left, you see the base score. So you have your map and your 5 levels of WASH insecurity in a country. Then we take the data, and here it just says protection. This is just an example. But then we take our indicators that are related to gender-based violence risk, and we overlay that with the base score. And that creates a new picture of where we may want to prioritize work when we are looking at the intersection of WASH and gender-based violence risk. And in some places, you can see that the situation gets worse. And in other places, you can see maybe the situation is better. So it's really just a starting point to help actors to have a conversation together to talk about what is the analysis showing us? Is it showing us that in some areas we have very high coverage of actors that are integrating gender-based violence risk mitigation measures into their program? So the situation is better there. And there are other areas where we have gaps, and we really need to focus our efforts on integrating and more meaningfully mainstreaming gender-based violence risk mitigation. So this is how we can use it to generate dialogue between WASH actors and gender-based violence actors, but also to really target our programs more meaningfully. Okay, we can go to the next slide. So today, I wanted to reach out to all of you as gender-based violence experts to solicit your input as subject matter experts. So we've already gone through kind of a first phase with Pamela and some other colleagues within the Global WASH Cluster and UNICEF to identify a list of potential indicators or data points that we think could be interesting to include in the gender-based violence module. And so we want to get your thoughts on these data points. Are they the right ones? Are they the wrong ones? Would you suggest other ones? And really another piece of that is then looking at the thresholds. So we have a 5-point scale. How do we make thresholds across this 5-point scale? And I'll have an example on the next slide that meaningfully capture the data we have and are useful for analysis. And then there are several other pieces around. We have a base score with many indicators and a gender-based violence module with maybe only 1 or 2 indicators. So we need to add some weighting to these indicators to really make the analysis show a difference, to create the different images we see based on the integration of this data. And then we have a lot of emerging questions around how we're defining different elements within the scale and the indicators. So it's kind of to provide some troubleshooting. So really today I wanted to share what the WASH insecurity analysis is, and then see perhaps who might be interested in providing some follow-up feedback through email, as well as if there are questions or want to discuss further on any level, then through setting up bilateral calls. But we'll go to the next slide, where you can see the example of where we got to. So this is a list of 9 or 10, depending on how you count, data points or indicators. And with the WASH insecurity analysis, we don't collect new data. We rely only on existing data. So we have to be really conscious of that as our first filter when we're thinking about which indicators could we include in the module. And we know that there's not the same data point collected across all countries for every geographic area down to the community level. That just doesn't exist. So we also want to have indicators that we know are commonly available. It doesn't have to be available everywhere. You can see in the list of indicators here that some are really more relevant for a camp setting, and some are potentially relevant more for a community setting. So we want to have a mix, because the idea is that in a given country, if you want to do your analysis with the gender-based violence module, you could pick 1 indicator, you could pick 2 or 3 or 4, whatever you have the data for, and whatever helps you answer the questions that you have that you want to answer. However you want to use the analysis, that can help you select the indicators, but always kind of with the picture in mind that the data needs to be available to help do the analysis. So that was kind of our first challenge. What data is available? And then on the right, you can see some brainstorming around where this data could come from. And then in the middle, you see the 5 scales. So it goes from phase 1, where there's a negligible level of WASH insecurity, all the way up to a phase 5, where there's a critical level. And for each of the levels, there's a different threshold proposed based on how the data is collected. And some of these indicators are based on expert feedback at the global level that Pamela was involved in and can speak a little bit more about, but also from feedback in pilot countries where we tested the current method. It was Mali, Kenya, and Lebanon. And so some of them you see, particularly the qualitative indicators like 1B or 2, they're really qualitative. And so one of the big questions we have is how can we meaningfully integrate qualitative data into this scale? because we know that's oftentimes where a lot of information comes from, but it's not necessarily quantifiable in records or in substantive reports. So thinking through quantitative indicators, but also qualitative indicators. So the idea is that whoever's interested, I can share, we have a format where you can add indicators, where you can propose new thresholds. We have some specific questions that we'd like insight on as well. So to answer a few questions if you want. And it's really flexible. If you want to provide feedback on all the points, all the questions, all the indicators, feel free. If there's only a few that you really feel like I need to say my piece on this, then we're also really interested in that. And there's not really a fixed timeline. Within the next couple of months, we kind of have a really loose time schedule as far as our collaboration with subject matter experts, because we know everyone is so busy. So I will stop there. Maybe first I'm going to hand it over to Pamela before questions to see, Pamela, if you want to add anything or clarify any points, because I know it's a bit abstract. So over to you, Pamela.
Yes. So within the Global WASH cluster, same with Marina, we have a gender GBV specialist that is dedicated to the Global WASH cluster. So we have been working closely with Angie and some members also of the UNICEF GBV and emergencies team. So we're really looking at existing data and what can be proxy data for gender-based violence risk. And also being cognizant of the fact that, for instance, some household surveys may have a responder bias for male head of households, and will that adequately capture the elements pertaining to risk? So I think those are the key conversations that we have been having for the past few months. So really, we are keen to engage our GBV coordinators and subject matter experts on GBV and protection to really make sure that we are capturing available data and informing the way that thresholds are designed, and also the weights that Angie was referring to earlier.
Thank you so much. Super interesting. I'm wondering, well, let's open it up for any questions from the group. I know there's a comment in the chat by Mirko Fernandez. From a security perspective, an indicator for security will be the extent to which women organizations are represented in local security fora. For example, in DRC, local security councils are mandated and required participation by CSOs. I see you coming on the screen. If you want to unmute and come in, feel free as well.
Yeah, I just think that when it comes to security, as long as women and girls are able to express their concerns in a forum with police, then that's a really good indicator. And some are mandated by law. For example, some municipalities require CSO involvement. So that is a way for you to be able to follow up. So there should be a source of verification in terms of following up on the indicators. I think that's a good one to look into. And there are questions about having safe access to water sources and other essential needs. There you can find that. So that's, I think, something important. I'm with UN Women, and we're working on gender responsive policing work line. And we've produced a gender responsive policing manual, which we highlight some examples from these Security Council mechanisms and the extent to which they can actually contribute to security, and the importance of them being able to access the information that they provide in order to inform your risk analysis. So have a look at that. I can put the link in the chat, and you can have a go. It's available in several different languages, including Ukrainian.
Angelica, I'm wondering if we should also perhaps put the contact information in the chat so that people can get in touch that want to provide more information, more feedback.
Sure. Yeah, sure. No problem. I'm also with UNFPA. That's my other hat, but I work on PSEAH on that one. So I have two hats.
Amazing.
So just let me know which one you're interested in. That's all. So that way I can find the line. Thank you.
Thanks so much. And April, do you want to come in? Do you have a question, comment?
Yep, sure. Just really wanted to say great presentation from both our education and WASH colleagues, and really appreciate the efforts from colleagues to really, put mitigation into practice. Because I think one of the things for us as OCHA is to constantly promote that, you know, responding to GBV is a collective effort. It is not only for GBV specialized agencies and actors, but that, you know, all of the clusters need to take this into account. And certainly a lot of the work that we're seeing and the research that we're, you know, seeing emerge is that education and the lack of GBV and prevalence of GBV. And so certainly really appreciate the work that the education sector is doing to address some of those issues. Just following on from Mirko's point, I really wanted to ask the question around how do we monitor some of these indicators? Because I think they're great indicators. But just from my field missions and going into so many emergencies and just seeing that what we have at the global level just does not resonate in practice, right? So we have these great indicators around, you know, sex separated, you know, safe wash facilities, etc. And we don't always see that consistently. So how do we, you know, how do we build in and strengthen that monitoring system so that the actors who are actually implementing these guidelines are actually doing
Maybe I can just quickly respond to the last point. I think, you know, you raised a great point, April, around the lack of systematic monitoring. And that's actually why we started with this module, because we know how important it is to really reinforce this just regular ongoing monitoring that is what drives quality programming. And so we're hoping by having this module and then saying to countries, hey, where's your data? We can kind of influence this cycle of we don't have the data, but if you had the data, you could do more with it. So it's really a collective effort, but I'm fully on board with you. It's definitely a challenge. So yeah.
Thank you. I just want to raise another pertinent question that we have in the chat from our global IM colleague, actually, Suman. She recently started working with our team. And she's asking how, if there will be any linkages between these indicators and HNO indicators to identify the severity scale in HNO for WASH.
We're hoping so. Yeah, so we're hoping so. We wanted to kind of bring the two methods together this year for the HNO, for this HPC cycle, but we didn't make it as far as the timing with the methodology. But we're really hoping, we're also working on improving data collection around common indicators, is that hopefully maybe by next year, some of the methods we use in the WASH insecurity analysis would be applicable for the WASH clusters or the national coordination platform. So that is a part of the vision. We're not quite there yet.
Thanks so much. We have one more raised hand, and then I'm afraid we're going to have to move on to the next presentation. But I don't know, EduEffect is the organization, I think.
Yeah, hi there. It's Emily Dwyer from EduEffect. We work specifically on LGBTIQ inclusion within humanitarian development programs. But I guess my question here is as much about inclusion more broadly. So with both of the presentations, you know, but I think these questions are relevant. But so just looking at the data point indicators for the WASH work here, I'm not seeing things like disability inclusion, and I'm not seeing LGBTIQ inclusion, and there's probably other inclusion measures that are also not appearing here at the moment as well. I kind of, and we work on, our specific area is LGBTIQ inclusion. So we are aware of lots of instances of gender-based violence that, whether it's someone who's lesbian or whether it's someone who's trans or gender diverse experiences, whether it's, you know, using bathrooms or accessing water points, different kinds of things. And I understand the reasons for trying to use existing data. For a reason, this has got to be practical, something's got to be able to be done. But we also see a lot of tools where people want to use existing data, and the consequence of that is that the marginalized groups are constantly left out of these kinds of indicators and processes. And so in some senses, it's unfair for me to ask this question of you in particular, but I guess I'm sort of just wondering at what point do we start collecting the data that allows us to actually do more intersectional work, or work that actually does include marginalised groups, where we know that those people face higher risks of GBV in WASH or education or other contexts. Thanks a lot.
You raise a really good point, and I think I'll start with an easy answer first. We're going to have we're also working right now on a separate module on disability inclusion, because we didn't want to put too many indicators into the same module, because it was seeming a bit complex. First, we actually did start out with an inclusion module, and then that got a little bit conceptually challenging, but it's something we might come back to. But disability inclusion we're working on. Around the inclusion of indicators related to the intersection of LGBTQ plus and WASH, I think it would be interesting to think about a qualitative indicator that we could propose. There's some qualitative ones now where we refer specifically to women or girls, but there's no reason why we couldn't include one that more specifically emphasizes LGBTQ populations. And even if that data is not there, I think, again, it's kind of a trigger to say, maybe you should be having this intentional discussion with the people who represent this group. So I think we could look at that, but I'd also be really interested in other ways that we could kind of work around this data gap. But as you said, not further marginalize people because the data's not there. So like some creative thinking we're definitely open to. So please be in touch. I would really appreciate it.
Happy to be part of that. Let's talk more.
Thank you so much. Thank you, Pamela, Angelica, and Esther. It was really interesting, and we will be sharing the presentations as well and your contact so that there can be follow-up and this can be a continued consultation. With that, we will have to move on to the next agenda point. We have Akiko with us, and I think, Akiko, you'll be sharing your own screen, right? Because of the imminent. Yeah, perfect. This is working. Yeah, perhaps I will actually hand over to Astrid just or do you want to come in after?
I think we can start with Akiko and then I can come in afterwards, maybe for time as well, right? So welcome, Akiko. Maybe just to say briefly, now I'm contradicting myself, saying I shouldn't say anything, and here I am. No, I just want to say we contacted Akiko really late, last minute. Akiko has been working with Lena and the park on updating the advocacy brief. But because of the scale up, there's a 6-month scale up in support of Sudan, we thought it was important to give the opportunity to Akiko to talk today, but she was given very little time. So basically a huge encouragement and a huge thanks. I think we had a meeting earlier this morning within the response division on the scale up of Sudan, and there were a couple of key takeaways that I think might be interesting for others, in that this time in terms of the scale up and what we may be expecting for benchmarks for the HCT and where we want to go, there seems to be a stronger push around advocacy and communications, in the sense that there's a clear let's say the situation is political, it's military, and the solutions are not humanitarian. But so the areas that were raised in the document I saw for the EDG priorities was around ensuring the safety and capacitating national staff, then around advocacy and communications, how we can reinforce that, while recognizing there are a lot of capacities on the ground. So it's not necessarily only about scale up. What we also heard from the UNFPA rep, and I'm sure Akiko will say the same, but it resonated with me sitting in the global AoR, that there's a real need to scale up and to with existing resources already, and that there's a need for more INGOs as well to join and to come in, because there are a lot of national and local actors. We always want to promote local and national actors for obvious reasons, but in the current circumstances where people are struggling with their own families as well, there is a need to also encourage international NGOs to play a bigger role. With that, I think, Kiko, can I hand over to you?
Sure. Thank you so
Our
much.
national coordinator. Yeah.
Yes, thank you so much, Astrid and Stephanie. Thank you so much for giving the floor. I'll be very brief. Some of you might have heard, attended my, presentation, the past couple of months. So just a very brief update. So it's been, more than 4 months since the conflict started, but instead of calming down, the conflict is getting actually worse. And also, the situation is becoming politically quite complex because, let me just go to the next slide. Just a minute. I think my slide froze. Sorry, I think my screen froze, but sorry. Okay, so previously, we had one authority managing, and coordinating a humanitarian response called Humanitarian Aid Commission. Now, as you may know, this is a conflict between the army and the paramilitary called RSF. Now, this paramilitary decided to establish their, own agency to coordinate humanitarian response under the, RSF-controlled area. So, the situation is becoming increasingly complex. And then what we hear from the field is, of course, there are conflict-affected areas. The red highlighted areas are all conflict-affected. Darfur, Kordofan states, and Khartoum is, Khartoum, we thought that it's going to get better, in coming months, but it is getting worse. Actually, we are trying to conduct remote, online training for Khartoum, but we had to postpone it because there's no electricity, communication shut down, and there is ongoing fighting, and people cannot really move. Extreme shortage of resources. So, and with this, there's a constant, there's an increased move of IDPs. What we hear from IDP hosting, states, which is, mainly on the eastern side and northern side of the country, where they don't have active ongoing, fighting, is that every day there is new arrival, and there's a really limited space in some accommodations. 2 or 3 families are sharing the same room, which is of course brings really increased risks for of GBV to women and girls. So the situation is really volatile and fluid. Also, because some countries stopped issuing visa, for Sudanese nationals, people who were originally going towards north, towards Egyptian, the border of the Egypt, is, some of them are now going down to the south, to try to cross border, perhaps to Ethiopia, Eritrea, or to South Sudan. So situation is quite unpredictable and fluid. So this makes it really difficult for us to respond. But we are, I will, share some figures, but we are trying our best to respond. And also to add to that, we are now, in the beginning of the HLP season. I was in a ICG meeting this Tuesday. So now the total number of IDP, that's published by IOM is 4 million. Next year, the projected estimated number of IDP might be as high as 7 million. So this is a very significant increase. This slide shows the overview of the revised HL PIN, and this figure, this map and percentage shows the increase of targets, not the PIN. So as you can see, the eastern side of the northern side of the country, a significant increase of needs, and then west side of the country, southern side of the country, there is a decrease. This is because there is an increase in needs, but the actual response, because of the accessibility, we have limited access to these states because of the ongoing fighting. We have to lower the targets. That's why it is lower and even minus in some of the Darfur states and Kordofan states. But in all states, people in need is an increase. And we are working now on 2024 HLP, but it is likely to increase even more. Our requirement was 63 million, but till date only 18.2% has met. So we are quite underfunded. Challenges, needless to say, there's shortage supplies. Supply is coming in from Port Sudan. We are trying to bring supplies from Chad. This challenge is the last mile delivery. Some of the really, localities, states with critical needs, we cannot access, and the last mile delivery is extremely challenging. And also, because of the increased needs of, supplies, there is a shortage of storage. This is not just for GBV subsector, but for all agencies, all sectors. So this is posing quite a big challenge for us in terms of operation. Of course, there's a power cut, water supply cut, and the interruption of the communication in some locality in Darfur states. They are they don't have any internet or means of communication for more than 90 days. So it is quite it's extremely challenging. Increased operational cost. This is putting a really heavy burden, particularly on national NGO, local NGOs, women-led organizations. The rent of the offices, and also consider that many majority of the organizations who were operational prior to the conflict lost everything. The offices are looted, so they lost everything. Some of them are even operating without laptops. They're just operating with phones, and they themselves are displaced. So increased operational cost and challenges is also putting extra burden, particularly on national NGOs and women-led organizations. Attacks on service provider continues, unfortunately, and access challenges. But I often get the question that is there anything provided in Darfur states where there is active fighting? I will show you the table, but yes. So some of the it's really, I really admire the courage and commitment of service providers who are working in Darfur states. They lost their family, their village attack. They lost the entire family. Some of the service providers went to Chad, but they came back and they are providing services in West Darfur. So there are service providers who are coming back and providing services. So, they don't just wait until the access resumes. Local responders are there to respond, particularly in conflict-affected states. And increased sensitivity on GBV. So we hear that, increased hesitancy on reporting GBV. And, really, we really need the community or women-led organizations to channel them to the services, increase the trust for GBV services, and disseminate the information. So just in a nutshell, total number of people reached from April to 15th of August is 121,512. So I would like you to look at how many are reached in Darfur states. So we are often get the comments that receive comments that we don't see anything going on in Darfur, but there are local responders who are extremely committed, extremely brave, staying at the front line providing services. If you can if you look at the number of people reached, almost half of them, the second last one from the bottom, almost half of the people reached are actually from 5 Darfur states. Dignity kits were distributed. We could not bring in new supplies, but they are preposition stocks. So utilizing the preposition stocks, we did address, the needs to some extent. Training is conducted, and despite that majority of the facilities were destroyed or looted, there are more than half of the women's centers constructed are actually in 5 Darfur states. So I'd like to show this figure to highlight that they Astrid, you mentioned that there are international organizations. They are operating the majority of them in accessible states, which is on eastern side and northern side, and that is really needed. But for the conflict affected states, we just want to emphasize that they are frontline service providers who are staying there despite the extreme security and operational challenges. continue to provide services. So we have 36 organizations leading response in 16 states. In Sudan, we have 18 states, so we are covering 16 states. So the priorities remains, priority remains the same, but, the need is increasing. So of course, because of the, increase of needs, we need more specialized services. We need, spaces to provide service, safe and confidential service provision in temporary or semi-permanent women and girls safe spaces. We have certain, rooms in the hospital where we call confidential corners, where we provide not only health services, but there are social workers and counselors providing comprehensive GBV services. Some of them were destroyed, during the conflict, but, some of them relocated and they were still operating. So we need more of these spaces, supplies, and also, there is a continuous effort to make it, deliver to the last mile, but rape treatment gets dignity, gets sanitary items are, still in need. And also addressing GBV in context with increased sensitivity. Of course, we need international NGOs to deliver, and it's a large scale emergency, but in order to bridge the beneficiaries to, and let them trust the services and, refer them, the GBV survivors to services, we really need community-based interventions, continuous, community-based interventions to win their trust and support local organization networks, in particular women-led organizations, and of course, GBV risk mitigation. Before I finish, I would like to really highlight on the structural barrier that, women-led organizations facing. So let's take an example of Jazeera state, which is next to Khartoum state, where they have a significant influx of IDPs. So there are 31 organizations which is in contact with GBV subsector, in Jazeera state. Of 11 are women-led organizations. 4 are currently operational, providing services, to some extent with very little funding. But, of 11, out of 11, 7 are really community-based. They are working on a voluntary basis. Some NGOs, women-led organizations, actually relocated from Khartoum or other states. They lost everything. They don't have any asset. The rent is too high. They cannot even rent offices, but they try to continue to provide services. And then, if there's international NGOs, they are, restoring the presence in IDP hosting states. They have better access to funding. So, the access to funding is, from the beginning, very difficult to national NGOs and women-led organizations in particular. And then, even for national NGO, there is a structural barrier. I visited field many times. If I go to national NGOs, oftentimes the managers who greet me are men. So, they are, the big national NGOs are led by men. I'm talking about NGOs that has relatively better access to funding. So, there is really a big structural barrier, and I think this is really a great opportunity to, address this structural barrier, and then, empower women-led organization. While we recognize that, there is a swift response, needed at the field level, and we also, closely work, maintain to work with, international NGOs. So that is all from my side. Thank you so much.
Thank you so much, Akiko, and you're very eloquent. And I hope it didn't. I think maybe it came out wrong. I wasn't trying to say we need to replace the local organizations. I think they continue to be the first responders and the ones who will make a huge difference, and they need the funds.
I totally understand
with that whole crisis, the needs are sufficient INGOs, or I don't know how. I remember, when the INGOs were kicked out some years back, I don't know how many are back. So that's more based on my lack of maybe. But of course, we need to really support the local who are risking their lives and putting their families at risk, going back and actually working in these very difficult conditions. It was more me trying to say it's much bigger than what we can expect them to do on their own.
No, I fully understand. This is our dilemma as well. Especially the needs in IDP hosting state, has, like some of the states, has, the need has increased by 960%. We cannot just address this by, particular type of organization. So we really all need to come together. So, and then, international NGOs are restoring their, presence in, in accessible states. So, it is great, and we welcome that. It's just that we have to work on both, really.
Yes.
And, yeah, and that's really a lot of work, but, let's hope that we'll pull it off. Yeah, thank you so much.
The other thing I gathered from your presentation, I think you're talking about the power cuts, the lack of electricity, the lack of supplies. And I think you mentioned this in one of your earlier briefings. It's also all the public hospitals and health centers crumbling, no? Under this whole situation, which is making it even more difficult.
Exactly. Yeah, exactly. And then, but there are efforts, from UN agencies in particular to support the field for the key hospitals, at state level. We cannot support all the health facilities, but for the key hospitals, that has emergency interventions, we are trying to support fuel and water and electricity as much as possible.
Thank you, Akiko. I see there are other hands.
Yeah, I think we have one hand up, April. Please come on in.
Hi, I don't want to be hogging the space, but I just really wanted to say, really appreciate hearing from Akiko, very challenging situation, and to still have you come and bring such short notice, really appreciate it. But I really wanted to link this presentation to Astrid's point about the need to step up advocacy as part of the Scale Up Sudan, and how can we as the GBV AoR and GBV community, and in particular with UNICEF and the various other UN entities represented here, and UNFPA as the lead, how can we support to really step up the advocacy? Because I think, we're talking about how critical the rise in GBV, and in particular the conflict-related sexual violence, and the exposure, to those risks. We're all concerned in. I'd love to hear, how are we stepping up the advocacy efforts in country by the UN, UNFPA and other UN entities when talking about this, and how they're strategizing, when talking with the, various authorities about how they need to be stopping this behavior, et cetera, et cetera. And what else can we do as a GBV community to support you, Akiko, in stepping up those advocacy efforts? Because I think that there's a lot of opportunity now that there is this scale up. So would really appreciate to hear, from you and also Astrid on how we do that. Thanks.
Sure. Couple of weeks ago, I was at I did a presentation for Multiple Partner Trust Fund, for CRSV, and there, our colleague, from OCHA Sudan presented. So, I really appreciate their support and and prioritization of protection, and GBV, particularly addressing the challenges. So you can see that in most of the challenges are operational challenges. Of course, there's a sensitivity, but operational and safety of providers. So these are, the things that we can also access, moving supplies. This is something we cannot do alone as GBV subsector. OCHA Sudan has been leading really strong, access working group, logistics working group, that includes, of course, participation from our sector as well. So that is, the continuation of these efforts is really, really appreciated. Since, we have really significant barrier, in terms of operation. I think addressing it together is really helpful. For the joint advocacy with other agencies, I'm already earlier there was a discussion on GB risk mitigation, but I'm already in discussion with UNICEF and WFP and also other cluster coordinator on risk mitigation, how they can, actually operationalize it in this context, given that there was limited resources. For instance, with WFP and FSO cluster, I discussed that, what about we have really limited human resources. What about sending our social workers to their distribution site or nutrition centers, so that they can support that we can reach out to more women and girls. We can create more spaces, even in other sexual information, to share the information and their experience safely and refer to the services. So I think the continued advocacy on mainstreaming GBV across sector is really needed, which UNFPA representative is going to also advocate in the next HCT, and hope to continue the collaboration with other sectors. Thank you so much.
Sorry, I'm struggling with Stephanie's computer. I mean, Jennifer is out this week. The activation just happened. All I can say is I would expect that we organize a core member call as well for the scale up, as we've done for other scale ups once she's back, to really think about a collective voice. It was the angle that was taken internally in UNFPA here in Geneva this morning, in terms of that saying, there are all these challenges, there are all these gaps, there are all these needs. Yes, we need to go faster in implementation through partners, but there is that huge issue around advocacy. And that's also why Akiko is working with Lina in the park on the updated advocacy brief. It's the third one for the last, since the crisis started 4 years ago. And I see Lina has her hand up. So maybe I should just hand over to Lina.
Thanks, Astrid. And April, this doesn't answer your specific question, which I think Akiko was able to come in on country level efforts. From the global level, we anticipate by the end of this week, hopefully, we'll have kind of a response to the scale up itself with specifics around what the GBV elements to the scale up need to be, particularly looking at what the EDG has come forward with in terms of their priorities for scale up, so that we're trying to anticipate where GBV is maybe left out of some planning. It will include some of the details that Akiko has put forward here today. And we really hope and anticipate that you'll be able to use it in your advocacy as well. So we plan on sharing it directly with the EDG as well as the HCT, but we encourage you all to use it and keep on the lookout for it. And then we will be looking to have a specific WRO WLO brief, which will come out later on. But we did want to respond quickly to that scale up kind of announcement. Thanks.
Thank you so much, Lina. Are there any other comments or questions before we move on to looking at DRC? Then again, such a massive thank you for the quick turnaround and for preparing to present the key issues during the call, Akiko. Thank you, and yeah, keep on strong. And with that, I'm gonna call on Christine Apio. Thank you. I see your camera coming on. I'll be projecting for you. You're calling in from where in the DRC, Christine?
Yes, currently in North Kivu, Goma. Thank you.
Yeah, thank you.
And you. Good afternoon, everyone. As we wait for Stephanie to project my slides, I arrived in DRC on 3rd August, and I spent a couple of days in Kinshasa. During the time I engaged at the city level, but also UNCT, I had a bilateral conversation with the GenCap as well as other actors. And then I managed to travel to North Kivu, where I first spent about 3 days meeting with OCHA, meeting with the protection cluster and other actors before heading to Ituri province, where I spent most of the days, about 9 days. And I decided to focus more on Ituri because that was where the team felt there was the biggest gap. I was supposed to go to South Kivu as well, but unfortunately, due to the time limitation, but also with the EDG visit, I couldn't make it. So basically, I'll try to incorporate some of the things that have come up into this presentation, although this presentation will focus more on providing you with an overview of findings from a rapid safety audit conducted in Ituri province. And I like the fact that, the first two presentations by UNICEF really set the face for this. Can we move to the next? Yeah, so I left out the context information because I know there were previously a number of briefings on DRC, and I trust you all are aware of the context. So last week we did a quick rapid safety audit mainly with the UNFPA and SOFEPADI as the co-lead of the Ituri GBV subcluster. And in terms of methodology, it was mainly focused on direct observation, but also discussion with community members. We decided to focus on observation on mainly WASH, shelter, but also the camp, because according to OCHA, shelter, camp coordination, and camp management and WASH are the weakest, are the sectors with the biggest gap in Ituri province. Next slide, please. So overall, as already mentioned, GBV risk mitigation across WASH, CM shelter, but also food security and livelihoods remain a major gap in the camps. And this is creating overlapping protection concerns, specifically exposing women to sexual assault, but also adolescent girls, especially to exploitative transactional sex. Next slide, please. So let's look at WASH. Majority of the latrines and bathing facilities are not segregated for males and females. And this got me really angry because, I mean, we're talking about 3 decades of humanitarian response in DRC, but I think we are not doing any better with risk mitigation. There were very few, maybe in Kigonze camp, I think I only saw 2 latrines that are segregated, majority are not segregated. And that also came up in the community discussions. Women reported lining up to wait to take turns bathing. Some bus facilities are not functional. And if you see the picture, I think I took the picture of the toilet. The first one, the first door is functioning, but the second one is not functioning. So, and a number of them are like that. In Raw site, which is in Jugu territory, according to the camp committee members, each latrine block serves 500 households. And we looked at a couple of latrines which are already filled up. Apparently, some of the community members, including women and girls, are using the bush for defecation. Next. Access to water remains a challenge for women and girls living in the displaced sites. For instance, in Raw displacement site, which has a population of 64,662, there are only 4 water points in the entire camp. While in Kigonze, out of the 5 water points constructed, there only 3 are functioning. And you can see from the photo, we observe a number of people, women and mainly adolescent girls and children fetching water from water point at the health facility within Kigonze site. This below is a picture of one of the water points that is not functioning. In raw site, women reported walking 5 kilometers to access drinking water outside the camp, which is further exposing them to sexual assault and physical attacks. One biggest concern was also with the structure of the wash facility. There's a video I took, I don't know, Stephanie, if you can play it, but it was extremely very challenging for me to access this water point. So I'm imagining how women and girls are able to access without, getting injured, or but also whether persons with disability can. You can play. Thanks.
I'm not hearing anybody.
Can you hear the sound? Perhaps because I was on mute.
Okay, thank you. Sorry, the sound wasn't there, but I think you have really seen. Let's go back to the presentation. Just imagine how difficult it was for me to sort of access, with an empty jerrycan. So imagine, and I mean, this is 2023, and we are still constructing water points in such a structure. Shelter, the situation in the displacement sites are deplorable. Low capacity of shelter constructed are only 3 meters square, yet housing more than 6 people on average, with some, can you hear me? Okay, with some shelters housing up to 18, 19 people in Kigonzi site. Shelter lacks secure doors with locks, which could potentially expose women and girls to sexual assault during the night. You can see a picture with example of a door, Those are the kind of doors we have on shelters in the sites. In 2023, I entered into a couple of shelters, and trust me, I couldn't even sustain my breathing. I mean, there are no provision for aeration, no windows, no private sleeping areas. The same space is used for cooking, storage, and sleeping at the same time. So just imagine being inside a small cabinet where you don't have windows, but that is the same place you're cooking. I think we are exposing displaced populations, especially women and girls, to health hazards. There are concerns around exposure of children and adolescents to sexual sins, which is contributing to high rates of teenage pregnancies within the camp, according to community members. This particularly came up in raw IDP site. Next slide. Camp coordination and camp management. Security and safety issues around the site were raised as a concern. For instance, about 31 cases of rape were recorded within raw site between 1st and 22nd of August alone, according to SOFEPADI, which is providing psychosocial support services and case management in raw camp, further revealing significant gaps in security and protection within the camp, the site environment. But also there are safety and security risks outside the site, especially when women walk 9 kilometers to collect firewood because they have to cook the food that is distributed to them. Women shared reports of physical attacks, including killing and sexual assault while collecting firewood. They shared a report of a man who was reportedly killed on 5th August in a nearby forest while searching for firewood. Underrepresentation of women in camp leadership structure remains a concern. In raw camp, for example, only 3 out of 11 members of camp committee are women. And according to the women representative in the camp committee, one among the 3, she mentioned a 50-50 representation is actually ideal to ensure their voices are, they have votes. Because while they feel that their voices are heard, their main concern is that when it comes to voting, then majority of the men vote against decisions that women favor. So they think of having a 50-50 representation in the camp committee would actually be ideal. And I think this must be the good practice. Next slide. So even there were lots of issues that came up linked to food security and nutrition in both sides. In Kigonze IDP site, displaced population have not received food for 9 months now. And lack of access to food is, we know poses dire consequences for women and girls. Adolescent girls, according to community members, are engaging in exploitative cyber sex for as low as 1,000 Congolese francs. I don't think this is even $50, to buy food and basic necessities for their families. I felt so bad when an old woman just, fell down, broke down, and she cried, when she mentioned lack of food. And I know there are conversations around durable solution, but again, I think it's also about saving lives. Community members reported that 2 children had died just a couple of days back due to anger in Kigonze site. So if children are dying, and I can attest that even when I moved around, the children I observed playing around, their eyes were completely white, not really having energy. I couldn't observe any sign of cooking within the site, even, at 2 p.m. when I left the site. So in raw site, even though there were no concerns raised around access to food, but women expressed preference for cash that would enable them maybe make wider choices, and most importantly, make decisions to purchase fuel for cooking instead of risking going to the forest. Next. So in terms of recommendations, really, I think we need a joint-up response, especially between food security, CCCM, shelter, wash, protection, and GBV. I think this is urgently needed. And where feasible, we are strongly recommending joint safety audits to ensure there is collective approach to identifying and implementing joint actions to mitigate risk. One of the biggest gaps at the moment is really implementations of risk mitigation measures across the different clusters, across the 3 scale-up region. Women and girls must be key actors in their own protection, and it's critical that they actively participate in identifying GBV risk and concern linked to the different clusters in the camp. And we know that this is in line with the Interagency Minimum Standard 2, which emphasizes women and girls' participation and empowerment.
Thank you so much, Christine. Can I, we're actually not going to be able to open up for broader questions and comments, but I would ask people to put questions, any questions in the chat so that we can make sure to address it, that Christine can answer. Selfishly, I do have one question. I was hoping that you could maybe explain just a little bit how the recommendations will be taken forward. What are the next steps?
Okay. Can we move to just the next? I think I have only 2 slides left.
Oh, I'm sorry.
Yes, please. Yeah. There's hardly any targeted interventions currently for adolescent girls. Really huge needs on that areas. I already spoke about the need by WASH, shelter, CCM to systematically assess the potential GBV risk linked to the interventions. And the next slide, which is probably the last one. Yes, reflection. I really got angry because I happened to lead the call to action pilot in DRC, and some of the issues that came up during the pilot, remains the same questions. The male-dominated humanitarian operations, especially at subnational level. And the question I'm really posing to all of us is, might the current humanitarian response system in DRC be reinforcing patriarchy and gender inequality? I think we need to ask ourselves, 30 years down the road, the situations of women and girls have actually deteriorated. If you look at the gender inequality index for DRC, it is at the bottom. So I think this is a question for reflection. Yeah. Stefan, I don't know if you would like me to answer questions before just talking briefly about the upcoming symposium, which is just the next one slide.
I'm sorry, just because we are so short on time and we still have one agenda point, I would ask that we can perhaps move the symposium to the September call, since it's upcoming, and I think we can announce and provide some more information with the next update as well. But if there's other questions, please do put it in the chat so that we can make sure that Christine responds them. I was wondering though how these recommendations are now taken forward. If you can just say a couple of points on that, what will be happening with the findings of the safety audit. And then April was commenting as well. And
yeah, thank you for that. Quickly, it has been shared with members of the Ituri GBV subcluster already. We had a briefing with the protection cluster coordinator for Ituri, but as well as with UNICEF bilaterally. UNICEF did make a commitment of taking up actions to address some of the risks identified related to WASH. I think they mentioned, a plan to construct additional more latrines. The protection, the GBV sub will be having further conversation with the protection cluster to convene a meeting with the key priority clusters. And one idea that they will be exploring is possibility of piloting joint safety audit. There's also a briefing note that has been developed for the EDG visit, as well as key messages, and most of these recommendations have been incorporated into it. Last evening, I had, on the past one, I had dinner with the Chief of Child Protection for UNICEF because she was having dinner with the UNICEF representative in the EDG. So she requested me to provide her with a key recommendation that she will also provide to the EDG representative for UNICEF to share with the others. And we're also having a meeting with Germany on Friday in Kinshasa to kind of discuss how Germany, as the current call to action global lead, since they have expressed interest in championing GBV, how they can take up some of these recommendations. Yes, so there are conversations happening. Thanks.
Thank you so much, Christine. It looks like the mission was really timely and you've done an incredible amount in a very short time. I think Astrid wanted to come in.
I just want to ask, because we were in contact with Christine over the last days and on that briefing with Christine and with the Esmeralda, the coordinator, and the rep, and Jessica on the briefing. Were you able to meet with the EDG mission, or will you be able to, or is it through the UNFPA rep? How is that happening?
So, great question. So, I think today the EDG mission kind of changed. Initially they were supposed to be in North Kivu, then go to Ituri, but then it was kind of swapped. And then, so they're in Ituri from yesterday. They are coming back to Goma, I think today or tomorrow morning. Tomorrow they will be in North Kivu. And unfortunately, it's the same day that I will be moving to Kinshasa. But I've ensured that, in terms of the key messages, we're trying to kind of ensure that the different organizations who are represented really get all these key messages and try to get them to their representatives in the mission. However, in the event that they pass through Kinshasa, I think there might be opportunity to meet with, yeah. But right now, we're really trying to influence, through other agencies who are represented in the mission.
Thank you so much, Christine. And given the time that we're at 5, we had one last point, and I hope we can all stay on for just a few more minutes. We have Anna Tizita with us, who was going to provide us with some highlights from the Women Deliver conference on presentations on participation that she's seen when she was attending on localization. Anna Tizita, can you come online? I hope you're still there.
Yes, I'm here, Stephanie.
Thank you, Anna Tizita. So yes, please, the floor is yours.
Thank you so much. Unfortunately, I don't have a presentation, but I will talk of it if that is fine, because
that's great.
Yeah, I'm Anna Tizita Samuel. I'm the Executive Director of Women for Change. Women for Change is a women's rights organization in South Sudan who is co-leading the GBV subclass at the state level, and I want to say thank you to all the presenters. It has been a wonderful presentation from all the presenters. I have learned a lot, actually, a lot of things from the WAS cluster, education cluster, and then to Christina. I think it's a very insightful moment. And again, that is also the advantage of this BHA project, yeah? The women-led organization co-leading the GBV subcluster. So we get to have information which people have not gotten. Basically, we'll just talk on few things that I feel we, as the GBOR, also need to maybe also look at. I remember when I was in Geneva, we did have a call with Jennifer. Jennifer was in the call, and briefly I also highlighted on what was happening. So basically, the Women Deliver Conference 2023, which I know most of us know what Women Deliver is, basically to discuss on issues that are affecting women and the way forward, action on what people need to take so that issues that are affecting or are emerging issues are addressed. So this year's theme, this year conference took place in Kigali, and the theme was on spaces, solidarity, and solution, in which basically spaces is talking about spaces will be given to especially the aspect of gender. Spaces will be given to the women in terms of leadership, in terms of even the localization, minority groups or minority organizations, youth group, the LGBT women's rights organizations would be given the spaces so that they experience, they can learn and they can also share. And then when it comes to solidarity, people will stand together especially when it comes to issues like crisis, when it comes to movement building, people will stand solidarity, and then the solution, we will have realistic solutions that are driven from the people who are affected and can solve their problem. And basically, all those, when we look at them, it's talking about localization. In that, there was a lot of conversation. Most of the sessions were talking about localization, and then we did participate also in a few sessions during the event where they are talking that it is now time for people not to talk about the issues of localization, but it is time for people now to talk about the impact, because the discussion has been right from 2016 to date, but things are not moving. Other countries are progressing, others are not progressing. What could be the problem? Donors or key stakeholders in the terms of localization should now look at evaluating what has so far done, and then what has not worked should also be addressed, but we should not be talking about now. We need localization. It is now past talking about it, but walking the journey and implementation stage. What also came out clearly was the climate impact on women and girls. You know, climate affects a lot of the women in the world, not only in other parts of the world, but I think it affects them. So if people are talking about actions will be taken, stakeholders, government, if I can say the humanitarian sector should look into how climate issues should be addressed so that women and girls are safe. Because it came out clearly that climate issues are affecting women and girls in terms of their menstrual cycle, in terms of their hygiene, in terms of, because water is contaminated, things are affected. So all actors need to look at climate issues. And then another thing that came also very clearly from all the conversation was how GBV should be integrated in all programming. And today I'm very happy to see that the different clusters are having already action points on how GBV should be mainstream in every sector, whether it be in wars, whether it be education, whether it be NFI, so that violence against women and girls is reduced in the societies. And then how also sectors like for example, we brought in the ideas of how the GBV at a global level is championing the localization agenda, especially in supporting the minority group like the women's rights organization, taking lead in coordination level. And it was a session which was shared by Trocare, and as a partner that is also supporting localization, I think it also came out very clear in the discussion. And then another thing is GBV and SRHR, the sexual reproductive health rights should go together. It should not be separated, that GBV should be discussed alone or implemented alone, and then sexual reproductive health or rights will be implemented alone. All of them should go together, because in most cases, they are like sisters, they move together, and they are most of the women and girls are facing those challenges in the society. So people should like actors, platforms like this one should talk about, and then about how this will be moving out. And then also I'm happy that UNAP is in this call. I think they are the champion of SRHR. So let's consider that GBV and the SRHR should go together in all our implementation, even to the worst classes, to what all those should go together, because they are affecting and causing a lot of issues in the society, especially on women and girls. And then another session that came also clear is how donors will open their doors to women-led organization, youth-led organization, and then also organization for persons with disability, and then the other minority group like LGBT, how donors will work. And then there were very many sessions on how this women's rights organization or this minority group organization can really push out the donors and how they can go about. So those are things that basically really came out and stood very clearly. And I feel as the GBV, most of these things are what we are, the GBV is trying to champion. So it's good to have a look at it. And then also the participation of women-led organization in global forums is also something for visibility purposes, is something that is also very key, that I think about more of the key sessions we are talking about them. And then the issue of leadership, which the GBV is doing very well. I'm looking forward to seeing what cluster, education cluster, benchmarking what the GBV is already doing, to see that women's rights organizations are also co-leading, because co-leading clusters, because it's from the clusters that decisions are made. So once decisions making spaces, the youth-led organization, the women's organizations, persons with disability organizations are not there, How do you expect them to influence policies? How do you expect them to make decisions that are constructive for the to people? And then support to grassroots organizations also was something that was very clearly that NGOs should be able to support grassroots organizations, not necessarily the women-led organization, but even the women-led organization at the national level. But what of those at the grassroots level? Those that are not, who are doing the real work also at the level. So they need to be supported. So basically those were the key highlights that came out. I could briefly share in the interest of time that I feel it's necessary for us and we can really move forward. And I want to say thank you so much, Stephanie, for the opportunity, and to everybody, especially the GBV since yesterday for the support up to today. I would like to end here. Perhaps if there are follow-up questions on what I've said, yeah, welcome. Thank you.
Thank you so much, Anna Tesita, for sharing your impression. And I'm super happy to hear that localization was so central to a lot of the sessions and that there was really space and reflection also on what the impact looks like. And yeah, that you were able to come and be part of the discussions. I would have loved to hear more from others because I think some of us on this call have also been at the Women Deliver, and it would have been nice to have a longer discussion around it. We really thought that today our agenda wouldn't be very packed and there would be time, but as you can see, I am not the strongest at time management, so apologies to all for going over, and thank you for staying on and being able to finish the agenda. We also had an announcement, but it was made now in the for webinar series from ELRA. Ian put it now in the chat. I don't know if you're still online and you want to make a quick announcement still. Otherwise, we'll also be sharing it on our website. But I see you're still here.
Yeah, really, I'll just say that it's there in the chat. It's coming up. It's focused on humanitarian innovation, which is our focus at ELRA, humanitarian research and innovation. And I think a couple of the topics really chime with what we've heard here about one's looking at gender bias among humanitarian GBV responders, which seem to chime with the male domination of NGOs in Sudan and in DRC. And another really echoes around looking at how monitoring and evaluation approaches that are being innovated now can drive change. And that's one of those looks at localized indicators, a framework for localized indicators, so that the big frameworks hopefully actually sort of get tracked on the ground as well. So yeah, have a look at the link in the chat, and it would be great if people can spread the word, see what interests you most, register and come along and listen. Thank you.
Thanks so much. Maybe just mention what's the timeline, when is the series taking place?
Yeah, so the dates are there in the chat as well. The first one is Tuesday, the 12th of September, and that's new approaches that target the knowledge, attitude and behavior of GBV program and clinical staff. Next, Wednesday, the 27th of September, looking at M&E, driving GBV work, and then 25th of October and the 8th of November, looking at cross-cutting methods, bit of sort of cash-based approach in GBV and technology in GBV as well.
Thanks so much, and a big thank you to everyone, all the strong presentations we've had today. We'll be sharing all presentations and we'll be uploading the meeting as well if you want to rewatch anything on our YouTube channel. With that, thanks again and a lovely evening, afternoon to all. Bye.